Hi, I'm Becky and I'm going to be talking about a part of the DAPL project where we've been working together to try to find ways to recognise when someone with a learning disability may have a palliative care need. So why is this important? Well, if you came to the webinar where we reported the results from our big database study, you'll have heard that people with learning disabilities have their palliative care needs recognised later than other people. So we found that often the first time palliative or end-of-life care was mentioned in people's records was in the last week of their life. But knowing someone is in the last year of their life can improve care. So palliative care services can get involved and help with treatment with symptom management. Plans for treatment and care can be made in advance to avoid crises. People can have time to feel more prepared and to say their goodbyes. So we wanted to find ways to help identify when someone may be in the last year of their life. So we wanted to consider who should be responsible, what might the barriers and facilitators be, what's already out there that could be helpful, and what can we do as a group to help. So we got together a co-production group of people that we thought might be involved in this. So this included families, learning disability services, palliative care professionals, GPs, and hospital and community services. It was 18 people in total. And outside of the co-production group, we also spoke to people with learning disabilities to find out what's important to them. So within these co-production groups, we did a few different things. We've had 6 sessions so far. And in the first session, we worked together on these Miro boards, which are basically online post-it notes, to understand what the barriers and facilitators might be for each of the groups in our co-production group. So as an example, people from learning disability services felt they may not always be listened to by healthcare professionals, and that it can be hard to notice gradual changes over a long period. Things that they thought could be useful would be clearly documenting what's normal for the person so that you can notice any signs and symptoms that may have changed, and also better relationships with healthcare staff. So we also looked at what's already out there. So there are a couple of tools designed specifically to try and help people notice that there is a palliative care need. The group thought these were very comprehensive, included the right sorts of questions, but that really they were quite clinically focused and wouldn't be picked up by learning disability staff or by families. There was also a concern that the one that was designed for the general population, rather than specifically for people with learning disabilities, had some symptoms that might actually be quite normal for some people with learning disabilities. So there were concerns that palliative care needs could be overdiagnosed. People really liked part of this Restore tool, which gave really clear instructions on how to communicate with a healthcare professional, what the problem was, what your concerns are, and what you would like to happen. But this specific tool seemed more focused on acute problems where we're looking more at sort of changes over time. We learned a lot from the group's experience as well. So we heard some great examples of outreach and education when palliative care services, community learning disability nurses and learning disability services have worked together to recognise palliative care needs and then provide the right care. We heard family stories of both positive and negative experiences of palliative care. We heard an example from a GP who used weight monitoring to notice deterioration in his patients who had learning disabilities. We heard about routine health monitoring used in learning disability services. So for example here you can see the health calendar which some services use to note people's symptoms daily, including showing red alerts that require immediate action and amber alerts showing things to monitor and to discuss with a manager. So we wondered if rather than just using this for daily symptom monitoring, we could use it longer term to notice changes over time. We also talked about baseline documents that show what's normal for the person and wondered if we could use these to notice when someone's health has deteriorated over time. So we brought all of this information together and then talked together as a group about what our options could be and voted on what we should take forward. So there are a few decisions that we made as a group. We decided that we should focus on families and learning disability staff. There's a lot of other people involved in recognising palliative care needs, but these are the people who are going to be seeing the person day to day and really notice any changes. But it's important to highlight that we're not suggesting that these are the people who should be noticing specifically a palliative care need, more that they should notice that something has changed and that there's been a deterioration over time, and that they should be communicating that with a healthcare professional. And the other thing the group thought was that showing these changes visually was really important. So both to help the person notice those changes over time to begin with, and then also to try and get their point across to healthcare professionals as well. The group decided that the best approach was to make use of routine health monitoring that's already taking place in services and to find ways to visualise this. So we've built a tool where you can enter weight each month to notice any concerning trends. If you use a health calendar, you can enter how many red and amber alerts have been documented each month and see what that looks like over time. So for this person, you can see that maybe mobility has been getting a bit worse over time and pain has been increasing, so that might be a sign to seek some medical help. There's also a timeline to enter things like hospital admissions, unscheduled care, so 111 calls, A&E attendance, that sort of thing, and any other significant events like things like falls. So you can see, for instance, for this person, maybe hospital admissions have been increasing and it's been taking longer to get discharged, so maybe that's a sign of you should be concerned about. We also want to make use of any documents that record what's normal for the person and guide people reviewing these to check how often this has been needing to change as the person's needs increase. And all of this is designed to allow learning disability staff and families to spot gradual changes over time, which they may not have otherwise noticed. So there's guidance to explain what to look out for and how to communicate these changes and your concerns to a healthcare professional. The GPs in the group really liked this visual approach as they felt it gave a much clearer summary of what might be going on for someone that they might not see very often. We also thought that multidisciplinary working was really important and had heard about some great examples in the group. Ultimately, the group decided we could have the most impact with the tool I've just described on the previous slide, as it's simple and doesn't require big changes in the way people work. But they wanted to make it clear that the multidisciplinary approach is the best way to recognise and meet palliative care needs. So we're going to work with some of the DAPL ethographers to create a case study of one really great example of multidisciplinary working, and we can hope that can inform other services who may want to set up something similar. So what's next? Well, we've got one more co-production session left, and in that session we'll finalise those resources. And then we'll test them out. So we'll take them to learning disability services, to families, to GPs, and anyone else who may have a role in this to understand, to get their views on, would this be helpful? Is it something you do? And would it help you to recognise when someone may have a palliative care need? So thanks for listening. I'll be available at the end for the Q&A session.